Thanks for tuning into the current state of research on MDMA-assisted therapy. Today, I'll be addressing those who have been curious about what's going on behind the scenes in regards to the recent FDA decision to decline approval for MDMA-assisted therapy as a modality of practice, after the Phase 3 trials in August of 2024. And just to be clear right off the bat, this wasn't a full shutdown of the treatment or the research. It was more like an acknowledgement that this treatment shows promise, but there are still gaps in the research, especially around study design and long-term evidence that need to be addressed before this can be approved as a treatment. So I want to talk through what actually happened, what the research really shows, and whether there's still a reason to be hopeful about where this is going. So whether you're a research junkie, psychedelic enthusiast, or a trauma survivor hoping and praying for widespread implementation of a better path out of post-traumatic stress disorder, stay tuned, and we'll hopefully clear up some of the confusion behind this latest setback. First, let me clarify what MDMA-assisted therapy is. At a basic level, MDMA-assisted therapy combines traditional trauma therapy with a few sessions where MDMA is used in a controlled clinical setting. The idea that MDMA can temporarily allow people to address their trauma in therapy in a more emotionally open way without being triggered or re-traumatized. This is definitely not like a take one and see me in the morning type situation. The structure usually involves a few prep sessions, a few sessions where the participant takes MDMA, and then integration sessions afterwards. So small pilot studies testing the safety and efficacy of this treatment started in the early 2000s with very promising results. And across those studies, there's been a pretty consistent trend. 61% of the people who undergo this treatment regimen no longer qualify for PTSD. That's opposed to 23% of people who are able to recover from their PTSD at some point in their life with the existing approach of antidepressants plus therapy. That's a big deal, especially considering how hard PTSD can be to treat over time. A lot of the participants in these studies had severe or long-standing trauma going in. There's also some evidence that the improvements actually stick. Follow-up studies show this number jumps to 68% of participants no longer qualify for PTSD diagnosis in the one-year follow-up study. On top of that, there are some secondary effects showing up too. Things like better sleep, reduced substance abuse, and increases in post-traumatic growth. So it's not just about symptom reduction. It might also reflect a broader shift in how people relate to their trauma in their lives. And for those of you listening who are dealing with trauma yourself or supporting someone who is, this matters because it points to the possibility of something more than just long-term management of symptoms. Given all that, it makes sense that people were hopeful about FDA approval as the Phase 3 clinical trials were held in the 2020s. So why didn't it happen? The issue wasn't really that the treatment didn't work. It had more to do with how the studies were designed. One of the biggest concerns is something called blinding. In a clinical trial, participants aren't supposed to know if they're getting a treatment or a placebo. But with MDMA, it's usually pretty obvious. So the participants and the therapists can tell. That makes it harder to separate the actual effect of the treatment from people's expectations going into it. There's also concern about how controlled these studies are. Most of them happen in very structured environments with highly trained therapists and a lot of support. So the question becomes whether those same results would actually show up in regular clinical settings. There are some limitations around sample size, participant selection, and how the long-term follow-up studies are handled. So the FDA's position was basically that the results are promising, but the evidence isn't strong enough yet to support it as a treatment. That doesn't mean it's over. It just means there's more work to do. There's still some pretty clear gaps in the research. There's also a need for better long-term data. Some studies show lasting benefits, but not all of them keep strong control groups over time. And then there's the real-world question. Can this be done outside of specialized research settings? Can it actually be scaled safely and effectively? Those are still open questions. At the same time, there's a strong signal in the research. Across different studies and phases of trials, the findings are pretty consistent. And that kind of consistency is hard to ignore. So, is there hope moving forward? Yeah, there is. But it's probably going to take some time. What needs to happen now is more rigorous research, better approaches to blinding, or at least stronger ways of accounting for expectancy effects. More attention to long-term outcomes and real-life functioning. Another limitation of the phase 3 trials was the demographics of the participants. A majority of them were white and had tried MDMA in the past, which may influence their perception of the outcomes of this treatment. By including a more diverse array of participants, it can be better assured that the treatment works across different populations. If these conditions are all addressed, this could eventually become a legitimate treatment option for people with trauma. This has the potential to address an issue that ripples outward and affects the social fabric at large. Because trauma doesn't just stay internal. It affects relationships, stability, housing, substance use, and overall functioning. So a treatment that helps people process trauma in a lasting way could have effects beyond just symptom relief and change the way people present themselves in the world and relate to their surroundings. At the same time, there needs to be some caution. It's easy to overhype something like this. And it's important that if this does become widely available, that it's done in a way that's ethical and accessible by everybody who needs it. So honestly, where things stand right now, it's kind of in the middle. It's not a failure, but it's not a breakthrough yet either. It's more like a pause. The research looks promising, but it still needs to mature. And if it does, there's a real chance this could become part of the future of trauma treatment. So even though the FDA decision was disappointing, it doesn't mean the door is closed. It just means the next phase needs to be done carefully and done right. Researchers are regrouping and moving forward with the next phase of this work. That means they're improving how control groups are handled, tracking people for longer periods of time, and collecting more real-world data on how people actually function after treatment. There's also a push to expand the research itself. More diverse participants, different types of trauma, and studies that look at how this therapy works outside of highly controlled clinical environments. Therapists are being trained to apply this intervention, and researchers are continuing to expand and refine MDMA-focused studies moving forward. So, even though the FDA decision slowed things down, it also clarified what needs to happen next. And if those gaps are addressed, there's still a very real path forward for this to become an approved and accessible treatment. Thanks for tuning in.